Boldenone Undecylenate, more commonly known as Equipoise. So we're going to go into it today and talk about Equipoise. It's an interesting steroid. One of the most commonly used ones in bodybuilding for both bulking and cutting. It's an interesting steroid. One of the earlier developed ones. I believe it was originally first developed in the late 40s, but I don't know that it was ever used in humans at that point. But we'll get into it a little bit and talk about it here. So. Boldenone. So properties. One thing I want to talk about real quick that drives me nuts. It's shocking. I hear a lot of coaches and bros on the internet telling people. It's surprising this comes from coaches that clearly don't know what the fuck they're talking about, but saying that you shouldn't use things that were never approved for human use, and they no, obviously they've never read about Boldenone and looked into it, but it was used in humans in the 60s and 70s. Yeah, it was used under the name Parentabol, and it was used as a treatment for osteoporosis and muscle wasting. Um, and these guys are going around telling people you shouldn't use things because it was never approved for human use. It's veterinary. It's true that Equipoise itself, equa being equine for horses, is a veterinary steroid, but the original, which is chemically identical, Pernobol is chemically identical to Equipoise. It was used in humans. Um, so let's get into it a little bit more. It's a structurally altered form of testosterone. It is very closely related to testosterone. There's a double bond between the one and two carbons. Um, this reduces the estrogenic side effects. It's basically test without all the estrogen conversion. It converts at 50% of the rate of test. So really just kind of think of it as test without all the extra estrogenic side effects. Um, Same anabolic properties as test, same anabolic rating as test. Lower androgenic properties than test. It doesn't have as strong of an effect on things like your prostate masculization, but it's still I wouldn't, if I was a woman I wouldn't use it. Um, so the androgenic rating is 50, anabolic rating is 100. There's also a common bro misconception that it's similar to Deca Nandrolone. I don't know where the fuck this comes from. It's not even from it's not even from the same tree. They have completely different properties. There's no progestinic activity, and it's from the test tree. It's not even. Yeah, I don't know where guys get this shit from. Same thing with the it was never used in humans. Um, it reduces to dihydroboldenone rather than DHT, which is interesting. It is a far more potent androgen, while it converts via the 5AR 5AR inhibitors do not work on it, so just something to be aware of. Although it doesn't bind strongly with the scalp, prostate as readily as DHT is, so you shouldn't have to worry about your prostate swelling up and peeing like an old man or your hair falling out like you would with tests. So it should be easier on those side effects. Um, Another thing that's really, really interesting about DBOL is and I'm sorry, Equipoise. Chemically, Equipoise and DBOL are the same. The only thing that's really different is um, Equipoise isn't methylated like DBOL is for oral administration. Now, while DBOL does have some different properties because it converts to a more I got the name escapes me, but the methylation causes it to convert to a more potent um, estradiol than regular test does or Boldenone does. So it could cause some nasty estrogen side effects. But essentially, Equipoise is a cleaner version of D-ball. So if you want to take D-ball, just use Equipoise. You get the needle out without all the nasty side effects. So yeah, it is interesting that they're both, the is essentially the same. So effects of Equipoise: increased protein synthesis, like all other steroids, increased nitrogen retention, increased IGF-1 production, increased red blood cell count. It has a reputation for raising red blood cell count more than just about any other steroid. Maybe Anadrol is worse. But so if your hematocrit gets high, that's just something to be aware of. You may want to stay away from it. I don't have issues with my hematocrit. I've said this in the other videos, but it bears repeating that a lot of people, a lot of times, I see hematocrit issues. It's not actually hematocrit issues, it's hydration issues. People just aren't drinking enough water. If you drink plenty of water, that those numbers tend to go down. Um, Inhibition of glucocorticoids, stress hormones like cortisol, so it does suppress them to a certain bit, which could make it good for cutting. Um, and increased appetite. This is interesting. I have a friend who uh, used to race horses, and he told me that they use it in race horses because race horses tend to be spastic and don't eat a lot. And the equipoise will get them eating more, and it also helps them keep on muscle mass, so they're not super thin, and they get food down, and it helps them be bigger. But he said mainly they take it for the appetite for the horses. I don't know if that's true or not. I don't know a lot about horse racing, but that's what this dude told me. Um, Side effects of EQ: it's mild compared to testosterone. It's a cleaner version of testosterone essentially. Um, with the exception of the hematocrit, it does tend to raise hematocrit more than red blood cell count, more than testosterone does in people, some people. Slight risk of aromatization. Like I said, it's pretty mild. It's 50% of test. I've run it by itself and not had to use an AI, where I do with tests in higher doses. Um, Slight risk of androgenic side effects. We mentioned that before: body hair growth, baldness, um, benign prostate hyperplasia, acne, all the typical stuff. Women should probably stay away from it unless you want to be a dude. I don't know. That's your personal decision. It does suppress testosterone, um, natural test production. All steroids do to a certain degree. Applications for EQ, I personally think it's great for size building, especially if you're somebody who struggles to put down a shit ton of rice and chicken. It will increase your appetite. I get hungry as fuck when I use EQ. Not that I have any problems with appetite. I have the opposite problem. I want to eat all the time. Um, it's great for strength gains. It's not the best, but I think I get more out of nandrolone as far as strength and size gains go, but I don't have as many side effects as I do with nandrolone. It is certainly a very, very good alternative if you're sensitive to nandrolones. I find nandrolone to be more effective for putting on size and strength, at least for me. But I know some people can't handle nandrolone, so it just fucks them up. They end up bloated, anxious mess when they take nandrolones and start growing boobs from the progestinic effects of it. Just something to keep in mind. It is an alternative to nandrolone, or if you can't afford Primobolan, I think it's the best, really, if you can afford it. safest, the best profile of safety versus benefit. It can be used in fat loss phases. A lot of guys use it in fat loss phases. Personally never have. I may try it at some point. When people are using it in fat loss phases, I generally see it as an alternative to test. High doses of test because it doesn't convert to estrogen at such a high rate. Helps you keeps you full. But you that way you can keep your test doses lower, or you could use it instead. Um, the Undecylenate ester is a very long ester, 14-day half-life. It can even be longer in some people, but and they said a drug test, it can be detected up to a year after administration. That is fucking crazy. And you got to think too when you're using it, you have to run long cycles with Equipoise because it takes so long to reach peak concentration in your blood, and we're talking about a month probably. I'd have to look at the steroid calculator to see exactly, but I believe it's about a month before you actually even hit peak concentration, maybe a month to 6 weeks. So, it would make sense to run this on a 16 to 20 week cycle. And you also got to think about when you come off of it, it's going to be in your system for a long time, months, for it to taper down. So when you actually stop, you haven't stopped. So that's just something to think about. Yo, bro, I'm going on a cruise for 3 weeks. No, you're not. You still have EQ in your system, so it's not really a cruise. Cycles and doses. Beginner dose is 3 to 500 milligrams per week. Intermediate dose is 500 to 800 milligrams a week. The pro dose or national level competitor, they usually stack it with test. 900 to 1,000 milligrams a week. Not, it seems to be dosed in 300 milligrams per cc. Most of the UGL shit I've seen, so guys are taking 900, 3 shots, 3 cc's a week. So 900 milligrams a week seems to be the common dose I see. My experience, I get very little in terms of side effects from it. Like, yeah, I do like nandrolone better for size, but nandrolone can make me anxious sometimes, and I've had issues with Guido, and I got to be careful with that because sometimes it can make it flare up. Um, so it can be a good alternative to that. When I've used it, I had a feeling of wellness. I just felt good when I was on it. No side effects, no anxiety. I slept really well. My appetite was great, which I think would make it good for for me personally for putting on size. I don't know. I haven't tried, like I said, I haven't tried it for cutting, but with the increased appetite, I don't know if that is a smart strategy for me when I'm dieting in a fat loss phase. If my appetite's I already have trouble controlling my appetite, I don't need something that's going to increase my appetite even further when I'm on a diet. I think I would lose my goddamn mind. Um, like I said, I have not had hematocrit issues. Typo there. Um, but I know some people that get the hematocrit gets crazy high on EQ. So if you're going to try it out, I would try it out on low doses first because the half-life is so fucking long. It's going to take forever to get it out of your system. If you end up, blowing your hematocrit up to like 60 or something, it's going to take a couple months to get it back, months to get it out of your system. Um, and you're probably going to have to go donate blood or get, at that point you're probably too high to donate blood, but have bloodletting done. Um, like I said, I've only used it for hypertrophy um, purposes. I don't know. For me personally, I don't think it's a good choice for cutting because of the appetite issues. That's my 2 cents. You may be fine, but I would not probably first go. I would not try it on a fat loss phase. Thank you. Please like and subscribe to my channel. Hopefully you find this helpful. Please feel free to ask questions. I enjoy answering questions. And if there's any videos you would like me to make, I'm open to suggestions. Please send them my way, and I will record more stuff. Thank you for watching my video.